4. We have 16 that are 65 years of age or older, and the rest are of younger ages. 20 now have recovered, 35 are in self-isolation, 11 are hospitalized, 4 deceased. The profile of how they were contracted still has the largest grouping being travel-related, 15 that are close contact, a growing number community acquired, and that number will keep growing as we shift from this being travel-related to being very much transmitted in the community, and speaks, as always, to the importance of people taking their precautions, assuming that people that you encounter in the community could be cases, they can be asymptomatic and still transmit. And so people have to exercise social distancing, 2 meters away from other people, avoiding crowds, washing our hands frequently, considering carefully whether or not you really do need to go out, and self-isolating in your home if you develop symptoms for respiratory illness, and seeking medical attention if your symptoms are severe, and in particular shortness of breath, or if you're a healthcare provider or work in a long-term care facility, or live in a remote community, or a member of a First Nations community, in that we're targeting our testing for those groups. We do have our assessment centers up and running, 7 of them throughout Simcoe, Muskoka, including 2 in Muskoka, as a way for people to be able to get tested. But what's most important is if you develop symptoms, you need to isolate to avoid spreading to others and everybody else. You need to be practicing the physical distancing to avoid becoming a case or transmitting to others. If we look at our epidemiological curve, it is showing a rise, I would say, upward projection that's in keeping with what we're seeing provincially, that we're still very much on the upward curve, that we're not at the peak, and I anticipate that it will take weeks for us to get there, and that this will persist for months, and that people need to be prepared for that. They need to be prepared to exercise the physical distancing for the entire duration of the pandemic, and need to be listening in on our advice about what's needed and when, the maintenance of that kind of protection. Just drawing your attention to the line listing of cases, and if we go down to the most recent cases, the most recent ones listed from 67 to 71. 2 are community acquired, and 3 are close contacts of other cases. Their ages range from 20s through to 60s, and they are in self-isolation with the exception of 1 that is admitted for hospital care. I would also like to speak with regards to Spencer House. I had indicated earlier this week that there had been a healthcare worker at that facility who developed symptoms, and that facility is now considered to be an outbreak and fully under investigation, fully being managed to protect the residents and staff there. I regret to say that we have 18 staff that are identified as potential cases now, and 10 of those staff members have undergone testing, and we await results. We've had 2 residents who passed away suddenly, and we're awaiting results on them. We do not have confirmation as to exactly why they passed away, but that does need to be investigated considering the context, and we have 2 other residents who have been tested. So certainly the facility is fully implementing the control measures that we require, including staff all wearing masks to prevent further transmission. Just want to walk through a few other things. I'd like to talk about the modeling that's been done by the province that we heard about earlier today. Some of the important messages that came from that was that we could see between 3,000 and 15,000 deaths in this province from COVID with the present scenario, the present projections, and this is over a 2-year period. So they have noted that there's a potential for, by the end of April, some 80,000 people being cases and 1,600 deaths from COVID in this province. They also noted that had they not put in place the control measures that they did, requiring physical distancing and closure of non-essential services and schools, and restrictions of gatherings of more than 5 people, they could have had many, many more deaths associated with this situation. Perhaps they had mentioned in the range of 100,000, which is would indeed been truly tragic, and I think it's extremely important that the province had proceeded with the controls that they had cited. Our own modeling in Simcoe, Muskoka is aligned to this. We see that if we maintain the kind of controls we have now and do this throughout a 2-year period when needed, so we anticipate that this, if we do these controls now, the cases will eventually come under control over weeks to months. There may be then the possibility of relaxing the controls and the restrictions on people, but close monitoring so that they can be put back in place when cases start to rise again because of the potential for reintroduction of the virus through travel. So over a 2-year period with that kind of approach, we would anticipate local deaths to be in the range of 185 to some 2,000 deaths. But that had we not put in place tight controls, it could be as much as 20 times as great as this. So this all speaks to the utter importance of what the government, the province, has done in making these restrictions. These restrictions are extremely hard on us all, and of course we need to look at how to mitigate them and look to how we can relax them when possible, but we're going to be in this possibly as long as 2 years, possibly as long as it takes to create a vaccine to bring it all to an end. Just going to have a look at some of the other things that have come up. There was a question about negative test results that we've used as data to show the amount of testing happening in Simcoe versus Muskoka. And there was a question about whether we're getting all that data, because I had cited before that we were getting all the negative results and the positive results from Public Health Ontario laboratories, but when they started expanding out the testing to some hospital laboratories, although we were getting the positive results, we weren't necessarily getting the negative results. And what we found is that we are getting positive results. We're not sure if we're getting them all, and so there's still the possibility that we're missing some of those results. I have no reason to believe that there'd be a difference between Simcoe versus Muskoka with regards to missed negative results. Okay. We've had some other questions from the media. One was, how many of the region's hospitalized cases are on ventilators? I don't have that immediately in front of me. I can certainly get that information. Let me just have a quick look here. Yeah, I will get back to you with that information. We have the number of hospitalized cases, but I don't have right in front of me how many are on ventilators. Okay, actually I do have it now. So we have 11 individuals hospitalized right now, and of those, 7 are in the intensive care unit, intubated on ventilators. Okay. So what role does the health unit play in helping municipalities and hospitals set up temporary hospitals and morgue overflows if necessary? Is that type of planning already occurring? We play a supportive role in that. We, for one, encourage them. I encourage them to proceed with that kind of planning. We did provide them with the modeling data that I've spoken to very recently. We've encouraged them well over a month ago in setting up assessment centers. I understand that hospitals have been advised to look at their surge planning. We've certainly been advising them all along they needed to look at surge planning, but the business of actually setting up field hospitals or sites off of hospital where they could have other patients cared for, I believe that's happening fairly recently, but it's definitely happening. And we've been very much involved with the planning for mass fatalities as well. We have developed a mass fatality plan that we've worked with the local health integration network and have circulated to the hospital. So that is certainly something that's been happening. I cannot say specifically as to the state of that at this point. So I'm getting, here's another question, I'm getting some comments and doubting the severity of COVID-19 in the region, particularly in Collingwood, where until today we didn't have any new cases. How would you respond to that? I implore people to take this very seriously. The Premier certainly has implored that people take this very seriously. We have a mounting number of cases in our district. We have a significant number of cases that are hospitalized, and some of them have been quite young, in their 30s through to their 50s. And they've tended to be community-acquired cases, which tells me that we've been focusing on travel-related, and only the severe community-acquired cases have come to our attention. We therefore need to assume there are many more community-acquired cases than we're getting tests for. And I believe that people need to take it very seriously. If it's transmitting in the community now, and we know from research that there can be asymptomatic cases, you need to assume that individuals that you come across may in fact be infectious, may in fact carry this. You need to keep a distance. You need to practice the physical distancing practices that we've been advising. As I've said, we've seen some young people severely affected with this, hospitalized with this, and on ventilators. And we've had 4 deaths to date. The 4 deaths have been people above the age 70, but it is possible for a younger person to get this, particularly if you have a pre-existing medical condition. And then finally, there was a question about the provincial modeling, which I've spoken to. So at this time, I would be happy to take questions.
All right, we'll start with Andrew.
Hi there, how you doing?
I'm fine, how are you?
Good. I guess just circling back to Spencer's house, when do you expect to get the test results back for those who have been tested?
So the return on testing has become much quicker. The province has caught up with the backlog of testing. They've increased their capacity. Over 5,000 tests a day they can now do, so it's a 1-day lag. I would expect that, that we would get some results tomorrow.
Anything else, Andrew?
No, that's great.
Thank you. Nathan? Taylor? Sorry. Nathan Schubert?
Got me confused there for a second. Good afternoon. Doctor, I just wanted to ask, because you said something that caught my attention. Do you say we'll be in this situation for 2 to 3 years?
No, I said it could be in the range of 2 years. Our modeling looks at 2 years out. And the reason for that is because if we're very successful in controlling exposure through social distancing, we can avoid most people getting infected, which means most people will still be vulnerable to infection, which means they'll have to keep up on an intermittent basis those controls because it can readily come back and affect a population that is not protected. And that will remain the case until we can develop a vaccine and provide it, which is predicted to take somewhere in the range of 1.5 years from now. And then we'd have to have a program to actually deliver it to the population.
So 2 years to actually deliver a vaccine?
Yep, to get it done and out and the population covered, somewhere in that range.
Okay, thank you.
You're welcome.
Dawn. Hi, Dr. Gardner.
Hello.
So, you've been saying for quite some time now that this is going to go on for a while, as have other officials. But I think today might have been the first time that it has really been driven home to people in a very public way. And so that raises the question of how this sort of long-term effort is going to affect people's mental health, which you've spoken to in the past, but I wonder if you could just address it in the context of something that may last several years.
So, to be clear, I don't anticipate more than 2 years, but still that's a very long time, and I am concerned. This is unprecedented, this kind of restriction on the world's population. I read today in the media that some 2 billion people are under these restrictions in the world. And to have people confined in this way for like the whole population for such a long time is unprecedented. And undoubtedly it will be hard on us. It's hard on us even a short period of time, and I think it's even more hard on people who live alone. Like, if we're confined to essentially have intimate contact with people in our household only for such a long period of time, I really fear for people who live alone, and that perhaps they need to find special ways of dealing with this. Where I've said before that we need to avoid direct contact with people outside of our household, perhaps they need to identify and partner up with somebody else in a similar circumstance, and that way they would avoid utter loneliness. We all need to use our distance communication means of being in contact with each other, but I don't think that there's any experience that we can draw on to speak to the adequacy of that to meet our social needs, our emotional needs, our mental health needs. So we're in uncharted waters on this, and I don't think at this point I have a good answer for how to address that. I think we're going to have to figure it out together, but I have no doubt it will have impacts.
Thank you. Go on, Mandy. Thank you. Mandy.
Hi there. Hi. I have some questions today. Did any of the numbers from the Premier surprise you, Dr. Gardner?
The numbers from the Premier and from the other experts that spoke before, they did not. I had, for one, they're in keeping with our own projections, and our, I don't actually have access to or know the details of how their model was constructed to be able to compare with ours, but they are in line. They are similar to what we see. And I've had some communication with contacts at the province to have known that there was going to be something like this. So I'm afraid I'm not surprised.
Thank you. And one other question. I don't know if qualifies is the right word, but what qualifies someone to be hospitalized? What do they need to be showing to end up in hospital?
They would need to be experiencing respiratory failure or the potential for it, or some other system failure. People who have more severe disease tend to have other medical conditions. So it could be that those other medical conditions, diabetes or otherwise, or renal failure, are exacerbated with the infection. But most likely they would be experiencing shortness of breath, respiratory failure, desaturation of their oxygen levels when put on a pulse oximeter. We'd be showing evidence that they would require oxygen in order to keep up their blood oxygen levels, and a potential for them to be intubated and put on a ventilator in the intensive care unit.
Thank you.
You're welcome.
James?
Yes, thank you. Dr. Gardner, so the province's projections today stated by the end of April, if things were status quo, we'd see about 80,000 infections. I was just wondering locally if there's any numbers of what we could see here, both, things stay status quo, or if they do raise protocols to keep more people at home.
So let me just look up my own figures here. So our figures show that under the present restrictive physical distancing that we have for Simcoe, Muskoka, by the end of April, we would have between 130 and 200 cases. We could have in the range, and these are cases that we're aware of, that are tested and brought to our attention. And remember, that's always the tip of the iceberg. There's always quite a bit more that's happening in the community in the way of cases than what we see. So therefore, we end up with a potential for more hospitalizations than those cases, somewhere in the range of 440 to 640 cases by the end of the month that are hospitalized. And in terms of deaths, we could have between 15 and 20 deaths. We've already had 4 deaths.
Okay, and just a second question. We're talking about this lasting 2 years. I know there was a bit of discussion about the seasonality of this yesterday, but Could you give me a bit of an idea of what that could look like in terms of reinfections and things like that?
So I don't have a crystal ball, and nobody knows for sure, but coronavirus, COVID-19 is a coronavirus. It's a respiratory virus. Very typically, they decline in the summer months to very low levels and then come back in the fall. We did have that experience with H1N1 influenza in 2009. And in that instance, it didn't go down to 0. It went down to low levels, but not 0. We still had some cases through the summer. And then it came back again in the fall. And that was also the case with the Spanish flu of 1918, where they had a spring wave, and then a wave that came in the fall, and then the following spring they had another wave. So we cannot know for sure, but it's possible that you could have the present wave continue through to the summer, die down, and come back again in the fall and through the winter is a possibility. And the degree to which we flatten the curve will depend on us continuing these kind of restrictive measures while it's actively in circulation.
Sorry, so just to clarify, this could be a third question, but I just want to clarify. So that means if this does come back in a seasonal proportion, we could be looking at another March and April situation?
You could be looking at this you could see this happening through the summer, maybe dying down in the summer, maybe coming back again October, November, through the winter season, possibly into the spring again. We cannot know for sure, but the models would be consistent with that, and the models would be consistent with the idea that if you relax your controls while it's circulating, that the cases and mortality surges and can overwhelm the healthcare system. So while it's circulating actively like this, we would need controls in place.
Thank you.
Thank you. And Erica, any questions?
Yes, please. The 2 deaths that you're investigating right now at Spencer House, when do you expect to know the official cause of death on those?
We've sent swabs for testing to see if they were positive for COVID-19. And as I'd indicated, I would expect that within a day, considering the turnaround in laboratory testing. At this point, I don't know whether what the coroner's office would dictate with regards to further investigations, such as cause of death. I don't have that information at this time.
Okay, thank you. And with 18 staff, you said potential cases. I assume that means they can't be at work for at least 2 weeks. Does that mean the home in a difficult situation for staffing?
The home is in a difficult situation for staffing. They are bringing in some nursing students to alleviate that, but they are in a difficult situation.
Anything else?
If you get results tomorrow, will you be doing a quick conference on that, or I know it's Saturday?
Yeah, and I appreciate the question. We were planning on having these press conferences Monday to Friday. We have had press conferences on the weekends before when we've had some momentous, such as our first deaths that occurred in Simcoe, Muskoka. So we would have to look at that as a team and decide. At this point, I don't have the answer for you.
Okay, thank you.
All right, did anyone join us after we started who hasn't had a chance to ask a question?
Hi, my name is Sarah Law, and I'm a reporter for MuskokaRecent.com. And I'm just wondering what employees can do if they feel that their workplace is maybe unsafe or their employers aren't doing enough to protect them.
So we're happy to take a call, and we do follow up when we get situations that sound very serious, in particular healthcare environments. But we have had people before have inquiries about their non-healthcare work environments. We're also very interested in pursuing any violations of the province's restrictions on workplaces that should not be open at this time, or public gatherings that are greater than 5 individuals. And we do work with the police in response to those situations. I have heard, though I need to confirm this, that the province has also set up call lines for concerns of that nature, but I think we need to get back to you with the specifics about that.
Great, thank you.
All right, Dr. Barrie, that's all the questions we have today.
Okay. Well, I wish everybody a good evening.
Thank you very much.
Bye-bye.
Thank you.
My name is Teresa McLennan. I'm the Executive Director of the Women and Children Shelter here in Barrie. And many of you know that we are a facility that supports women who've experienced violence and their children. And so while we always deal with trauma and the experiences of abused women, the situation for women is very heightened right now in light of what's happening with COVID-19. And so what we know is that as women are isolated at home and stress within the family increases, the intensity and the experience of violence for women increases. And so our work is always very difficult, always very challenging because we deal with trauma. But that is much more heightened now considering the climate that we're all in with COVID-19. So even though we are limited in being able to bring women into our shelter right now in light of COVID-19, our crisis line operates 24 hours a day, 7 days a week, 365 days a year. So at any time, even with COVID-19, we encourage any woman who is at risk of abuse, who's been living in abuse, to call our crisis line. And that number is 728-2544. And when a woman contacts us and she's explaining what's happening to her and her children, we will help them to safety plan what measures they can put in place to keep themselves safe while they're at home, what measures they can put in place to keep their children safe while they are not in school and not going out and visiting with friends. And we are working with women to create a safety plan for them to be able to leave. What we know is that when women leave and plan to leave an abusive relationship, that is when they are most at risk of being killed. Our work is to help women do that as safely as possible. So we have certain tricks and tools, I would say, that we educate women about that they can do that will help them to create that safety plan so that they're able to leave. Or they're able to remain in the situation if they have to right now, and how do you create safety around that? So certainly we want women to call our crisis line so we can give them that information. It isn't something that we speak about publicly because we never want to inform abusers of some of the things that women may be doing to create safety around themselves. We are experiencing a greater intensity. That's the best way for me to describe that. A greater intensity in the nature of the calls that we're receiving. And again, that is because of that social isolation that's happening for women who are needing to be at home with their children, with their abusers. So the definitely nature of the calls are very intense, extremely serious, and in terms of the increase in calls, we are experiencing a high level of calls, as we always do. So, the situation for us feels very much like what we always have because there's such a great need for our services in the community. And, we're always trying to get a handle on that. COVID-19 definitely adds another layer of the stress to those demands for our service. Moving forward, as we hopefully start to see sooner than later, that curve of COVID-19 start to level out, we will need to reassess the safety of bringing more women and kids back into the shelter and making sure that we are continuing the screening so that we can provide safety for everyone, for the women, the kids, and our staff. And it's probably helpful for our community to know that we have a full house of women and kids in the shelter, but we've also had to look at community accommodations, housing options for women and kids as well. So we actually have moved women out of the shelter into other locations, and we're now providing support to them as well. And we are needing to financially pay for the housing that they are in. So, dealing with COVID-19 for everyone in the community is challenging. People's incomes are all impacted. Health-wise, we're impacted. For us as a shelter, the financial ramifications of COVID-19 are massive. We have to fundraise so much money every year, and just to keep the lights on, we are not able to do the same level of fundraising now in light of COVID-19. So we're not seeing that same financial support come in that helps us to do our work. And now we have women and kids in shelter, women and kids out of shelter that we need to provide everything for. So we're paying for them to be housed in another location. We're paying for their food, their transportation, everything that they need. So our financial demands are greater with less fundraising opportunities to meet the demand. So we are in a very, very challenging spot financially for sure, as are all social service agencies that rely so heavily on fundraising, we're all in this place of trying to keep the lights on. Absolutely, financial support is key for us to continue to meet the demand that we're always experiencing, but in light of COVID-19, that increased demand of service. We are very appreciative that restaurants are reaching out and saying, can we provide a meal for your women and kids? That really helps us because we're not able to get the maybe the same degree of groceries that we typically would because we have to order for so many. So restaurants that are helping us with bringing in food and dropping it off at our door, fantastic. Many people are also dropping off just groceries, and so we really appreciate that as well. We would ask that if you would like to donate or to help us, to contact Kelly at barrieshelter.com, because that way we can talk about what you feel you'd like to donate and how the best way to do that is. We're wanting to be very mindful and cautious about how we are processing any donations that come to our door. So cleaning the packages that food is donated in, cleaning the bags that groceries may come in. We need to make sure that we are following our protocols and our practices to make sure that anything comes in also is clean and ready to go. And that's just a good measure for all of us in the community to be doing. So when you're going out grocery shopping for your own personal needs, when you're bringing in your packages, you're cleaning them and doing what you need to do. That is no different for us here. We just need to try and maintain a very, very high, hyper-vigilant level of cleaning. So any donations, we really appreciate that. It's truly helping us survive right now. And you can reach out to Kelly, that's Kelly, at barrieshelter.com. And you can connect with her, talk about your donation, and then we'll coordinate how we can either pick up that donation in a safe way or that you can drop the donation off to us. So we really appreciate and thank the community for just being so fantastic in helping us. You can also visit our website at barrieshelter.com, and there's information there how you can make financial donations. There's contact numbers as well, and that's a great resource just for anyone in our community to go to. We also encourage any women that may be listening. Our website is a great resource in terms of resources for leaving abuse and what you need to know to be safe. So please visit our website at barrieshelter.com. We really encourage that.
We've made a couple of changes here. We have closed our morning drop-in program. We just want to ensure that people are safe, so we don't want people coming into that program. That's closed for the foreseeable future. And then we've also made some significant changes in our grocery program, in that we've gone to an expedited process. Basically 3 minutes, 2 people come into the food bank at a time, they register in, we give them a little pickup slip, they go to our pickup door, they get a prepackaged grocery order, which should do them about 3 weeks. So it includes meat and vegetables, fresh produce, along with all of the various dry products and canned products and breads. So trying to feed as many people as we can and provide as much food as we can during this period. In the last couple of days, we've seen about 40 new clients who have never used our service before. And so I'm sure we're starting to feel the effects of businesses that have had to close for various COVID-19 reasons. And so some people are living on the edge, right? Paycheck to paycheck. And so if you take away that paycheck, we've got people who are in need of food right away. So we've seen about almost 40, a little more than 40, and I anticipate in the months to come that those numbers will grow pretty rapidly. What I'm really looking for right now from the community is, I'm not looking for food donations from individuals or I'll call them personal food donations. I'm looking for businesses that have access to food and they would like to make a corporate donation to the food bank of food, that would be fantastic. From individuals, I'd like you to go online to our website, barriefoodbank.org, make a donation, and that will allow us to purchase food locally from local grocery stores to buy the food that we actually need right now to feed those people who are in need. I'm anticipating that we're going to see a 15% increase in our demand over the next few months, and we're in a pretty good position to be able to handle that. But if we could raise a couple $100,000 in the next couple of months, that would make a huge difference to the people that are coming to the food bank. It is also safer for everyone. We're supposed to stay home. Some of us are essential services, the food bank being an essential service. We need to be here to feed those people who are in need. And so we want to ensure that we have the food to be able to do that. Your donations make a huge difference for us to be able to call up Joe's No Frills, call up one of the other grocery stores, pick up the product right from their store, right here. It's on a pallet. There's not a lot of handling of the food. And so we know it's safe, and we can give that out to our clients right away. For all of our clients right now, we've really expedited the process. We're ensuring that people follow the social distancing protocols. We don't want people lining up ahead of time. Because the process is so quick, there's no need for anybody to line up. Literally, you are here for 3 minutes. And so you can come anytime between 1 and 3:30. And like I've said, in the last few days, in the last 4-5 serving days, we've served 450 people. So 450 orders have gone out. And a lot of times it's not a lot of work. The work for us is ahead of time, preparing them. The actual distribution is very simple. And so you don't need to line up, bring an ID, don't practice social distancing, and if you have any symptoms, call us. We have a couple of organizations that we can work with to deliver those grocery orders to you. On Monday, Wednesday, and Friday afternoon, from 1 until 3:30 in the afternoon, we'll continue to do our grocery orders. I don't get this opportunity often enough just to say thank you. And so thank you to all of you who are making donations online, businesses who are making, today we had farmers come in and make donation of potatoes. We had different companies dropping off food for us. So thank you for making a difference in the lives of people that you will never get the opportunity to meet, but you are certainly changing those people's lives.
Well, in the initial stages, we did see an increase in appointment cancellations, both for individuals and groups. Once everybody sort of locked down at home, that was just the scenario. People were not coming out. And so imagine, if you will, that we rely on a lot of group donations to help fill our clinics on a regular basis. And whether that be a corporate group, which is now working from home, or a school group, which of course is not in session. So that was very worrying in the beginning. We have, since the call to action that we placed on the middle of March, we have seen an increase in bookings, which is fantastic. But we've also now are dealing with the reality that, outside of places like Barrie, where we have a permanent donor center, we call it a mobile event, where we, sort of come into town and set up at a community center, or maybe it's a church or even a hotel or something like that. We were finding that in the initial stages, once the municipalities closed all their facilities, we were left to cancel a lot of events, and that certainly impacted us greatly. Our donor centers are a safe place to be. And really, if you think about of all the branches of the healthcare system, we are generally where the healthy people hang out. So we only accept blood donations from healthy people. And if you've ever been to a blood donor clinic, you know that we ask an awful lot of questions. And certainly this is no exception. We have put some additional screening measures into place. to help screen people, and those physical distancing measures are certainly in place as well at all of our donor centers, whether it be our permanent center in Barrie or our mobile events. You will find that we have spread everything out to make sure that all the stations are well spread out apart, so you will not be shoulder to shoulder, with your fellow donors as you once experienced. So what this is, resulting in for us is sometimes a limited, reduced capacity of how many people we can intake because of these physical distancing measures. So we're doing, our very best to collect every drop of blood that we can because it is critical at this time that we still maintain a healthy inventory for those patients who need it. Well, I don't know that people aren't showing up because of a fear, but rather just the sheer fact that everybody's having to work from home now. They're taking care of their kids. It's a different world, and it's very difficult to manage. So again, just knowing that it's just only those healthy people that are able to donate blood. We encourage them to keep booking and honoring those appointments in the weeks and months to come, because it is a bit of a marathon, not a sprint, and we are going to need that blood on an ongoing basis. So in my experience, and I have been out at many of the events over the last week and a half, and what I see is a bit of a sigh of relief, I think, from donors when they come in and they see that we have put these measures into place with regards to physical distancing, because again, many are regular donors and they're used to being, lined up in chairs, waiting for their appointment and being in a tight space. So we have put those measures into place, and when they do arrive and see that, we are getting a sense of like, oh, okay, good. I was wondering what you were going to do about that, and I'm glad to see. And we're even seeing a lot of, posts on social media where people are commending us about our distancing measures as well. It is true. A blood donation would certainly help with that feeling of, I guess I'll call it helplessness, that we all experience when the unknown happens, and it's just a whole new world for us right now, and we're all coping, and that is certainly, a blood donation can certainly make you feel that sense of that you are giving back. So it's wonderful to see all the new donors, first-time donors, and what I like to call first time in a long time. So people who have maybe, donated in years past, but have sort of fallen off the wagon, if you will, and are coming back now and realizing that, yes, this is something I can do, and it's not a great deal of time commitment. And certainly we all seem to have some extra time on our hands. So it's a great thing to do. Well, what I would like to point out for sure, and especially if you've never donated before, or if it's been a long time, and even if you are a regular donor, I would like to point out a section on our website. If you just go to blood.ca, it's there right on our homepage, a whole section on COVID-19. And it's very important because it's all the questions and answers that we've been getting from donors as it relates to blood donation, how it affects the blood donation, what measures are we putting into place. And that is a perfect spot to go to if you're thinking about donating or if you have any questions at all. So, our website's always been where there's a great eligibility information, and now it's sort of contained in one easy to find spot right there as soon as you go to blood.ca. So I would encourage you to check that out. And then the other thing I will mention is that because of all the physical distancing measures we've put into place, at this time, we can only welcome donors who have an appointment. And it's important to come only at your appointment time. So we're not taking walk-ins right now. It's just very important for us to be able to maintain that metered dosage of people into the facility, that everyone has an appointment.
Traditionally, our model for food distribution would be providing members with the opportunity to come in. We'd have a quick meeting with them to just kind of put them into our system, and then allow them to essentially pick the items that they want. And so it was an interactive moment where they would be able to make sure that they're getting the items that they can eat, they don't have any dietary restrictions, cultural restrictions, all those types of things. And so there's a lot of interaction. And we realized, obviously, with COVID-19, we needed to be able to create a solution that minimizes the surface contact, and potential interaction to minimize the spread of COVID-19. And so our first attempt was, okay, let's do it outside. Let's have a distribution method where we pre-pack hampers and then provide our members the opportunity to still come to our facility and pick up orders for home. But unfortunately, we had to. We had a big lineup. We had about 50 people queue up, and it was just way too much of a line, and we were obviously having trouble managing social distancing, and we realized that wasn't going to work. And so we decided to make the call on last week Friday, to go strictly to delivery service only, and transition over to where people call in, and they're able to call in on Monday, Tuesday, Wednesday, Thursday from 11:30 to 2:30. They can call into our facility and make orders, and then we will distribute those orders the next day via a team of volunteer drivers. And essentially, we've had to screen all our volunteers and make sure that they are healthy, have not been outside the country in 14 days, under the age of 70, do not have any pre-existing health conditions that might put them at risk for COVID-19, and also themselves are making sure that they're self-isolating at home, so they're at low risk. We have tight guidelines as far as sanitization inside our facility, hand washing every 30 minutes, social distancing at all time, and are really locking down the safety measures within our facility to ensure the food that we're distributing is also safe. And so we're keeping our members safe as far as making sure that we're able to continue to deliver food. We know the volume is going to be increasing over the next few weeks, months, due to the number of layoffs that our region and regions have received recently. So we want to build ourselves capacity to continue doing what we do 4 days a week and not slow down. And so we wanted to protect our members, our staff, our volunteers, and making sure that everyone feels safe, but we're continuing to support our member base. Like, it's pretty strong in Orillia. We've got over 12% of our community's food insecure. We have one of the higher low-income rates in our region, and so the demand is quite high. We see over 1,700 people per month through our facility, and we know that will grow in the coming weeks and months. We're asking the community to make financial donations. There's two core ways that can happen. One is if you visit our website at sharingplaceaurelia.org, and you click on the Donate Now button. We have a secure site that you can make credit card or debit card donations online. And then the second method would be to send a check to our P.O. box in Orillia, and all that is available online as well. And people can mail the check to our facility or to our P.O. box, and then we can take those donations. And those donations are essentially buying exactly what we need for our food hampers. So we have all these prepackaged hampers that we're going to be distributing, and we know exactly what's needed to fill those hampers. And so if we get financial donations, we can purchase those either from our local grocery stores or from wholesalers, and have those items come in and get packaged up and out the door. And so it's much more efficient. There are so many people in our community that are the working poor, and they're working really hard, but essentially the minimum wage is not high enough to sustain life's necessities. And there's no shame in accessing food support that's available throughout your community. It's almost a necessity of the time. And so we have many members that are working hard every day at hourly wage jobs that have families and have expenses that go beyond what they can afford. And we're here to be able to support those people. And specifically during these times, we're here to support those that just do not have enough income to be able to get food. We need food, and it's the reason we're here is to support those people. So if there's anyone out there that feels that they don't want to access a food bank because they might be too proud, I would say that I understand that, but I would say that there is no shame in reaching out. Like that's what we do every day. And so We're more than happy to help people, more than happy to help people, and we can do so with the most amount of dignity and respect. We have a great group of people, no judgment at the Sharing Place at all. We welcome anyone that self-identifies as being food insecure or has trouble affording food throughout the month, and give us a call. Any new members do have to come to our facility to register. So that's the one thing that is required. They do need to come with a government-issued ID, so we can quickly register them outside our facility. And I guess weather permitting, just dress appropriately because it would be outside. But just definitely swing by our place at 95 Dufferin Street, register, and we'd be happy to help you out.
Well, obviously, we can't provide our programs and services in person as much as our entire clubhouse and structure is set up to be able to deliver things in a very confidential, very warm, very nurturing environment. We're forced into phone calls, emails, and utilizing Zoom conferencing. For a lot of our people, technology sometimes can be a bit of a hurdle. But whatever we can do, we're trying to do to be able to reach and deliver programs that are specific to our cancer community to our membership. And it's hard to be able to get just that little message into people with this huge issue that we're having to deal with as a society. But it's very important to our members to continue delivering those components of support. I think we're fortunate to have a namesake in Gilda Radner. She wrote a book, It's Always Something, and we've created It's an Always Something Fund. And if this isn't a time and a place to be able to utilize that under these circumstances, I'm not sure what it would have been used for. You always look to be able to make sure you're prepared for some of those unseen hurdles, some of those obstacles that come into play. This is one of the obstacles and hurdles of a lifetime. We've never seen this before, and hopefully we'll never see it again. But the opportunity for us to be able to try to find a way to stay viable and open for our membership, we explore a number of opportunities. There's new government programs that are announced all the time, but we live with donor dollars and on the support of very generous people in our community. So to let people know that we're still able to deliver programs and services under these times, and that there's sunnier days ahead. We're going to be open, and we're going to need people's help when that day comes. So, for myself and for a number of other charities, it's a matter of making sure that we get out there and are available to answer anyone's questions. I certainly think in situations like this, the saying "any port in a storm" works. We find any way possible to deal with the added stress that is imposed, but. We have masters of social work and registered social workers as part of our staff team available through phone, through email, and through the programs we're trying to offer online to help provide people with tools on how to cope with their cancer diagnosis. Certainly as this is such a dynamic and volatile situation where information seems to be changing at times hourly. We always look to be able to maintain a balance of, that future cancer landscape in the immediate concern of a deadly virus. And our community of membership is immunocompromised if they're going through treatments. They've always been much more aware of the dangers and the landscape that exists for them. So I think that, hand washing, not communicating people when you're sick has been much more of our landscape for quite some time. It's very acute and very significant right now, and it's for everyone. It's an uncertain landscape. We look, to hopefully some positive developments with regards to being to have fundraising events once again, golf tournaments, galas. So many of these events are fun to go to, but are essential for the small charities to operate. There's no government funds for us, so being able to connect with people and be able to share the story that our members go through is pretty important. And to that end, I find that, as we sit here and we go through and struggle with how to handle the coronavirus and this new reality on us, is that I feel that this is a glimpse of what it's like to be told that you have cancer. To walk into a situation where you don't know the answers, you have more questions. It's an uncertain future. You don't know what tomorrow holds. You know, the fear, the anxiety, you know, the emotional pressure that comes in, and you just want people to help you. And this is the life and journey of a cancer patient, and you know, this is what it is that Gilda's Club looks to be able to serve. I think that so many people are just waiting for us to hit that kind of peak. You know, it's flatten the curve. When we're on the downward side of that curve, you know, we will see the light at the end of the tunnel, a chance to be able to get out and engage. You know, for me, I want donors and I want volunteers to engage with us in a meaningful way, to ask tough questions of, you know, how my donor dollars are going to be used. I don't have as much money to give this year. I want to make sure that it's going to have maximum impact. You know, donors are in the driver's seat when it comes to their dollars. You get to decide where it goes, and you get to be able to have influence as to how it's used. And it's my job to be able to answer those questions and to be able to make sure that I'm available for people to see what it is that their donor dollars will have impact here at Gilda's Club. We've always considered this place a sanctuary for the people that need a little bit of a breath from the stress of a cancer life. They're able to come in and be able to take their concerns and really shelve them in some ways to be able to deal with what their needs are. And this includes people that are caregivers, children, parents. You know, we serve a wide community, and we look forward to doing that again in the clubhouse.
Our food bank works out of a municipality building in Elmville, and the municipality has closed down all their public locations. So we have been forced to use a small hallway in the back of that building. And the people who come to the food bank are not allowed in the building, so they remain in their cars. And we stay totally sanitized in our little area. We take our clipboards out to them, get the information from them as what the requirements are. We pick up the clipboards, we fill the bags with food, and then deliver it to their car. So we're not getting into those social interactions that are too close. We stay within the realms of our 6 or 8 feet, and the clients themselves are protected by being in their cars. We're anticipating there is going to be a growth. Elmville in the district itself, Elmville right down to Midhurst, anywhere in Springwater Township has a lot of young families. And these young families are being impacted by, you know, staying at home. A lot of them can't work from home, so therefore their paychecks are being compromised. So we are welcoming numbers to our food bank. We expect in the next week that these numbers will grow, and we have had people reaching out to us and saying, you know, we're not a regular client. We're saying, no problem. Please come to the food bank, look after your kids. School being closed, there again, puts a little bit more pressure on snack foods, foods for parents for lunches. So we're there for them. We're there for whoever is in any kind of need, baby diapers, formula, food, whatever people need, we have it. We have a very generous community, and the food bank is very thankful for that community, and it's our time to give back to them. We know that the food stores are struggling with, you know, keeping the shelves full. We have a good supply because we've had some good food drives, but what we are in need of is canned vegetables and canned stew, cookies, snacks for school for kids that are home from school, drinking boxes, juice, hamburger helper. Of course, hand soap is huge. Shampoo, Kleenex, toilet paper is a premium. We all know that. But if anybody wants to donate financially, they can donate financially or drop food off at the food bank when we're open. Or we do have bins around town as well that people can stop in and drop food in. So you can pick up food and drop it at the Foodland, or the Whitfield's Pharmacy on the main street has a bin. We do have bins in the local library, but that's closed, so that's cut off from us for now. So, and then when the food bank is open, we have put a cart outside, and we're welcoming anyone to come during food bank hours to drop off there as well. So Wednesday, 4 p.m. till 6 p.m., Thursday morning, 10 till noon. And given the timing next week, we could, if people want to watch our Facebook page, we can keep everybody updated there. The times could change if we find that there is a need. We can just put the word out that the food bank is there for everyone in the community. We can put the word out that if there's anybody that has excess food, we can take it. I think we worry more about the people who think that because coming to the food bank is, you know, putting sort of a label on them. Not at this point, not with this COVID-19. We really are there to help people feed their kids, feed their families. People are inside, people who are maybe quarantined because they've been out of the country. You know what? Just reach out on our Facebook page and we can help. We really appreciate the community, and we just know this is a tough time and we will help people get through it.
Good morning. My name is Colleen Simpson. I'm the manager of 911 and emergency planning with the County of Simcoe. And we're here to talk about a donation of personal protective equipment, or PPE, campaign across the County of Simcoe and District of Muskoka. Our partners at hospitals are very important right now, but we have frontline and healthcare workers across the region in paramedics, long-term care facilities, shelters, any of our primary care, community medical centers, anything like that. We need PPE for all of those workers. We're looking for other sources of PPE in organizations that might already be making these or manufacturing them, or stock that they're not using in places like dental offices, nail salons, tattoo artists, places like that would normally use PPE but aren't in. They're not using them right now because businesses are closed. Some others could be just a stock at home, retired frontline workers, or anyone else that may have had a stock of inventory that they could donate to us would be really appreciated. We are looking for personal protective equipment that will protect any of the workers, eyes, nose, face, hands. So things like surgical masks or N95 masks. So those are the ones that fit nicely on your nose. Face shields with plastic coverings for your eyes, goggles, latex-free gloves, gowns, hand sanitizer, and medical thermometers, because we are testing people's temperatures. Yes, we have had some donations come in already. I'm not aware of the businesses or organizations that have donated, but they have come through our Simcoe Muskoka District Health Unit, and we are starting to collect those donations. The best site is on the Simcoe Muskoka District Health Unit website, and if you do www.smdhu.org/donations, all the information will be on there. We can also email them at emergencymanagement@smdhu.org, and they will accept your emails for donations there. Our workflow has been pretty intense and all things related to this, but everyone is mobilizing and either working from home or working however they can to support our frontline services and all the operations that the county and our partners, external partners, offer to keep the public safe, calm, and maintain those businesses that we always offer our clients and customers. Things like solid waste, things like our roads department, our paramedic services are still working effectively and all pulling together to make sure we continue those services for our residents. I'd like to say that we are working our best to keep residents calm, safe, healthy. We're continuing our services, and we really appreciate everyone's thoughts, and would also really appreciate any donations they can make that fit those categories. And if they want more information, please visit the smdhu.org/donations website. You can also find more information on our website at simcoe.ca.
So the Gilbert Center for Social and Support Services have, of course, like so many other not-for-profits in Simcoe and Muskoka for that matter, we've been closed since March the 14th. all staff except for our harm reduction teams. These are 2 teams of 2, and they go out every day. They usually go between 5 Points and Mulcaster and Collier and Dunlop. That is where many people who are injection drug users or where homeless people are found during the day and evening, but we only go out during the day. And they also do needle sweeps. In fact, just recently on March 24th, when we were out, we picked up over 200 needles in the downtown area. And we also give out food product. We hang around the bus depot. We have food supplies. We give out, as I said earlier, unused supplies for crack kits, naloxone kits, water. We give out safer sex products, lube, condoms, things that are not going to be found that easily any longer. Sexual health clinics are closed in the county, and it's a lot of pharmacies. You just can't access those kinds of products anymore easily. So they go out. They're keeping social distancing. They have gloves. They have masks, but they don't have PPEs, personal protective equipment. That's hard to get. Even hospitals are having a hard time getting that. But they are working as close proximity as they can to make sure that folks get the products that they need. Most people are donating practical things like food. Some people are donating their time to make kits, safe injection kits from their homes, and then we pick it up. We leave the products at their doorstep, and then we pick it up when they're done. And that can be we can do online tutorials on how to put the kits together. So we do have like our youth group is continuing. Our 2S LGBTQ plus youth group is continuing for groups that normally would meet with us in Alliston, Midland, Orillia, and in Bradford. And there's a server link, and I can give you who to text to get the server link to connect to the online groups that are running through the Gilbert Center. Because a lot of youth are not out. Those that identify within the 2S LGBTQ plus are not out to their parents or friends, so we're very cognizant of that when we're doing anything that is taking place over the like the Zoom or FaceTime, WhatsApp, those Instagram, those kinds of things. Well, we've always been cognizant of the fact that sometimes we can't get a hold of clients for one reason or another, and we've always looked for alternate ways of getting a hold of clients. For example, some clients that don't have internet access, how do we contact them if they're in a rural setting? Like, how do we get a hold of them? How do we maintain confidentiality, which of course is a very big piece of the work that we do, because we work in an environment where people are testing positive, for example, for HIV, or they're within the LGBT community and they want to keep that part of their life anonymous. We also work with trans folks that aren't necessarily out. So we're more and more reliant on Facebook, which has been a great help to us because many people don't have internet, can get access into public libraries, but now the libraries are closed. So it's challenging. And if somebody wants to drop off food at our door, or we can go to if they have food products they want to give to the center and let us know where, we can go and pick it up, leave it at your doorstep, and we can pick it up. We will be looking at making crack kits, safe injection kits, probably next week, because our supplies fortunately just came in today. So there's that possibility. So there are things, if anyone's interested, they can text me and I can put them in touch with the right people at the Gilbert Center.
Hi there, my name is Sonia Reichel and I'm here at the Georgian Triangle Humane Society. We are in our main cat adoption room and hopefully we'll meet a couple of our furry friends at the end of this short video. We just wanted our community to know that during this pandemic, we are still here. We're still caring for the animals that need us. And despite our doors being closed, we are still offering essential services to the community. Those essential services come in a variety of forms. We are admitting animals on an emergency basis. So those are animals that are either found as stray by animal control or are found by community members and cannot care for themselves. So examples of this might be kittens that are found. We are starting to encroach upon kitten season, or stray cats or dogs that are hungry or are really in need of care. We're being very mindful of how many animals we're able to take in during this time because we have limited personnel, and as well we have closed our adoptions, so we only have so much space within the facility here. As well, we have expanded our pet pantry service during this pandemic because we recognize that there might be folks at home with pets that either can't leave their home or might not now be able to afford food for their pet during this time. And we really want to ensure that if there are folks in that situation, that they have access to the services that they need. In order to access the pantry service, just call our front line, 705-445-5204, extension 0. We are monitoring that line to the best of our ability, and it's for those 5 municipalities that we serve. So that's Town of Wasaga Beach, Collingwood, Clearview, Town of Blue Mountains, and Meaford. Once you call us, we're going to pair you with one of our incredible volunteers behind the scenes, and they'll actually deliver the food right to your front door. So please call us if you do need that service. And last but not least, we are offering an emergency boarding service. So that is for folks that might need to go to the hospital, or are fleeing a domestic violence situation, or are otherwise unable to care temporarily for their pet. We want to help keep you united with your pet during this time, and so we are offering that emergency boarding service as our resources allow. And the best place to learn more about that is gths.ca. Last but not least, we want everyone to know that we are so grateful for your support during this time. With our events and our programs not running, our revenue stream is quite limited, and therefore we have launched a campaign for compassion because every donation during this time is going to make such a difference to our ability to meet the needs that are arising within our community when it comes to the compassion for pets and people. So thank you very much for listening from all of us at the Georgian Triangle Humane Society, including Nash, who's in our main cat adoption room. We would just like to say thank you very much for the support that you're giving us and all of the interaction that we're seeing on our social media channels. We really love hearing from you. We are here for the animals and those essential services that I spoke about. And to learn more about our campaign for compassion, please visit gths.ca. Thank you so much.
Hi, my name is Jake, and this is Grayson. We're going to do a couple songs for you guys, and if you consider donating to the Barrie.org or BarrieFoodBank.org in this time of crisis, they're running short on food and money. So cash donations online, you can go to BarrieFoodBank.org.
When you're looking for someone to turn to, when you're looking for someone to learn to, 'cause we've all needed someone to hold on to, 'cause we've all needed someone who needed someone new. 'Cause you are the one, you are the one, you are the one that gave my life. 'Cause you are the one, you are the one, you are the one that gives us life. 'Cause you are the one, you are the one, you are the one that rubs my head at night. 'Cause you are the one, you are the one, you are the one that makes everything, you make everything alright, alright. Well, even in our darkest days, even in our different ways, there's 'Cause even when that sun goes down, even when you're not around, I said, you are the one, you are the one, you are the one that gave my life. 'Cause you are the one, you are the one, you are the one that gives us light. 'Cause you are the one, you are the one, you are the one that rubs my head at night. 'Cause you are the one, you are the one, you are the one that makes everything, you make everything alright, alright. I take your picture, she smiles back at me. You're capturing that brief moment, how it will always be. 'Cause even in our darkest days, even in our darkest ways, 'cause even when the sun goes down, even when she's not around, I said, you are the one, you are the one, you are the one that saved my home. 'Cause you are the one, you are the one, you are the one that saved my soul. 'Cause you are the one, you are the one, you are the one that burns so bright. 'Cause you are the one, you are the one, you are the one that makes everything, you make everything alright. 'Cause even in our darkest days, even in our darkest ways, even when the sun goes down, even when you're not around, I said, you are the one, you are the one, you are the one that saved my life. 'Cause you are the one, you are the one, you are the one that gives us light. 'Cause you are the one, you are the one, you are the one that rubs my head at night. 'Cause you are the one, you are the one, you are the one that makes everything, you make everything alright, alright. You make everything alright, alright. You make everything alright.
This song's called Fire. It's an original song. And please consider going to Barrie's live music show on Facebook and donating to the Barrie Food Bank there. And if you don't have Facebook, you can go to foodbankbarrie.org. Ready?
She's the fire that burns so bright, with a smile that could light up the night, with the will to move mountains, oh, love and grace just to clear your soul. She's on fire tonight. Well, she's on fire, man, burn, burn so bright. Well, she's on fire tonight. Well, she's on fire, man, keep my feet on the ground, make it all alright. Well, I'm standing tall and I'm standing strong. I just don't know for how long. I keep my chin up and I walk with purpose. Arms wide open cause we all deserve this. Cause she's on fire tonight. She's on fire, man, all night, alright. She's on fire and it burns so bright. She's on fire, man, all night, alright. Cause it's a game in real time. It's life and death, it's true sublime. There's no turning back, it's all ahead. It's all she knows, it's all she read. Cause she's on fire tonight. She's on fire, man, burns me right. She's on fire tonight. She's on fire, man. You keep my feet on the ground, make it all right. She's the fire that burns so bright. She's the flame that changed my life. She's the fire that lights my soul. She's the flame that keeps me whole. She's on fire tonight. She's on fire, man, all night, all right. She's on fire tonight. She's on fire, man, keep my feet on the ground, make it all right. Tonight. All right, all right.
Now, thanks for having us on today. My name is Jake Mathias. This is Grayson. And once again, if you would like to donate to the Barrie Food Bank, you can go to Barrie's Live Music Show on Facebook, or you can go to barriefoodbank.org. And supplies are running low there right now in this time of lockdown, and a lot of people are in need. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media. This is Rogers TV. Barrie.
I'm Mallory, and I was walking home one night when an impaired driver hit me. He had been overserved in 2 bars before getting behind the wheel. If the servers would have called him a cab instead of serving him more alcohol, my life would be the same as what it used to be. I think servers play the biggest role in keeping us safe because it's up to them what state the person's in when they leave. Refusing service isn't personal, it's the law.
For my kind, there was one place we were never allowed to go. Your world.
What are you gonna do?
Show this world for what it really is.